Hi, welcome to Bari Nation, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
If you are watching or listening to this podcast episode on May 6th, 7th, or 8th of 2026, I am in San Antonio, Texas for the American Society for Metabolic and Bariatric Surgery's annual meeting. And I want to tell you something. I do not take that for granted, not for a single second. 7 years ago, I was a patient who didn't even know ASMBS was a thing, nor that they had this conference. This year, I'm speaking at it. And the only reason Bari Nation can show up in that space, attending, learning, advocating, and bringing the newest research and treatment options back to you in this community is because people choose to fund this mission. If this community has ever helped you, if a podcast episode or a social post or a conversation in the Bari Nation support community has made a positive impact on your journey, consider paying it forward. Donate at barination.org and help us keep showing up in the rooms that matter. Hi, friends. Welcome back to the Bari Nation podcast. Today, I have the honor of introducing you to one of the coolest guys that I have gotten an opportunity to know, Dr. Charles Thompson. Hi, Dr. Thompson.
Hey, April. How are you?
I'm fabulous. I'm so excited for this conversation. I think it was it 2 years ago at last year's ASMBS? We were in the same room together, and you're a very tall man, so you're not hard to miss. But what I instantly saw was you were wearing a pair of 95 Air Maxes, the black, the gray, the white with the neon green at the bottom.
That's right. That's right.
Oh, those are my favorite shoes on the planet. And I instantly walked up to you and I was like, you don't know me, but I have those shoes as well. They're my favorite shoes ever. And from there, we started a conversation, and now it's blossomed into this opportunity to have this conversation on this show.
It has. It has. And as anybody else who has those 95 Nike Air Maxes knows, you feel like you're walking on clouds when you're wearing them. They're so comfortable. They're so comfortable.
And they look so good. Like, they are just the best looking shoe on the planet. And as soon as I saw you wearing those, I was like, we have something in common.
I appreciate that, because it's led to this.
It's led to this. And, we're kind of new to the ASMBS space, but the more chances that we have to meet amazing people like you, the more we really understand you are real people who are helping us with a real thing, and you absolutely want to partner with us for this lifetime care. And that's what came across in our first conversation.
Yeah, you're absolutely right. This is what I've dedicated my life to, helping patients who have difficulty losing weight and having struggles on and off continuously with that.
Yeah. And when we were at Obesity Summit this year, it was amazing to watch you take in the new information that was being presented, right? Not only from patients, but from experts. I saw you change your language. I saw you, even I could think a conversation you and I had, you said something and you're like, wait a minute, I want to walk that back because I'm trying to use this in a different way. And it was like, I think it was like our dinner conversation. It was amazing.
That's right. That's right. The thing about this medical condition, obesity, is that we're still at the very, beginning steps, or the infancy stages of truly understanding not only the disease itself, but how it affects our patients, how it affects society in general. Mm-hmm. And, obesity is one of those conditions that has been so stigmatized that in order to communicate effectively about it, you have to be very careful in how you're presenting what it is that you're saying. And so, it's again, something that we're at the beginning stages of understanding and really treating. And we just have to all be mindful of how we're presenting ourselves when talking about this.
And that's a perfect kind of transition into what we're talking about today. This conversation happened because you and I at Obesity Summit were like, okay, we're getting together, we're recording a podcast episode. And we knew that it wanted to be about how do people like me, a person and a patient, find somebody like you, right? Who's kind, compassionate, caring, and understanding that people are coming in with a history of fighting this disease. And in our like pre-recording conversation, we went to the websites where you're supposed to be able to find people.
That's
And you
right.
were not listed on any of the ones that we looked at. And it was like, oh my gosh, if you're not there, they're not finding you.
Well, and that was news to me as well, April, when you and I went through this process.
Yeah.
And then it got me thinking, well, how are surgeons or bariatricians being found? How are they listed on sites? Who lists them on sites? Who,
Yeah.
how do they determine who they're reaching out to add to their sites? And there is no rhyme or reason. It's really all over the place. And so that's why Berry Nation is so amazing, because just like with anything else in life, right? You ask your neighbor or your family member, you got a person to repair my refrigerator. You got a person to, mow the lawn. You got a person to paint that. Do you have a person that can help me lose weight? And, that is the best way, I think, that patients can find someone that is best for them. All the other websites are great. Don't get me wrong. And all the providers on those sites, deserve to be on those sites. But, if you're looking for someone to identify with you, word of mouth, as with many things, is probably best.
It, it's how I made my decision, right? I fought my excess weight for 20 years. And it wasn't until a friend of mine started looking amazing on Instagram. And I literally DM'd her and I was like, girl, what are you doing? Because you look amazing. I would like to do the same thing too. Veronica and I, we were the same size. We were very active. Like our life and our lifestyle was very similar. And when she told me, oh, I had bariatric surgery, or she might have even said weight loss surgery at the time, my immediate response to her was, what? We're not that big. Oh, no, we were that big. And bariatric surgery is one of the many effective treatments for the disease of obesity. But back in that day, I would have never considered having a procedure if Veronica had not had that conversation with me.
Right. Right. And, oftentimes, again, that's how things get started.
Yep.
Someone undergoes a process. That person is in your inner circle and you confide in them, they confide in you. And, one thing happens after another. And that's how
Yeah.
many of our patients
Yep.
come to approach us for help in losing weight and becoming more healthy.
Yeah. One of the most powerful moments at an ASMBS event that I've been to, and I don't remember which one it was, but we were in a room and Dr. Maria Curian was their past president of ASMBS.
Right.
And we were talking about this very thing, like how are people finding providers? And the conversation led to this word of mouth. And I remember asking Dr. Curian, right, is this true? Because everybody I know found their surgeon from word of mouth. And her response was, oh, yeah, I think 90% of my patients are my patients because one of my patients told them about me. So it's the
That's right.
same,
That's
right?
right. That's right.
And I think these conversations can be so powerful because right now, Dr. Thompson, the people watching and listening are getting to know you as a professional provider, but also as a person. And while you might be in their coverage area, right? Or maybe they don't want to travel to New York to see you. They know that you're a person that you can trust. So somebody might reach out to you one day and go, hey, Dr. Thompson, I saw you on this podcast. I think you're amazing, but I live in California, right? Do you have any recommendations of people who are like you in that area? And that's how care can happen sometimes. And that's okay.
Yeah. Yeah. And that's, one of the things that I like to tell really anyone, patients, providers, anyone who's willing to listen, is that weight loss and needing help and wanting help in weight loss is more like finding a plastic surgeon than finding a general surgeon. And what do I mean by that? If you go to your primary care doctor and your primary care doctor says, you have gallstones, you need your gallbladder removed, you should go to this doctor. And you go to the doctor that your primary care provider gives you. But unfortunately, a lot of providers have difficulty not only diagnosing obesity, but actively attempting to treat or refer for treatment. And so patients are left to their own devices and trying to figure out where to go.
Mm-hmm.
And as with plastic surgery, most patients are on Facebook or Instagram. Who has the largest following? That's who I'm going to go to. Dr. Miami in Florida, those kinds of things, right?
Yep. Yep.
And in bariatric surgery and in bariatric medicine, it's somewhat similar. If your provider is not referring you to get that help, not because they're intentionally withholding the referral, they just don't know how to do so, and that's something we can talk about perhaps at another time. But
Yeah.
if your provider is not referring to you, you're left to your own devices to figure out where are you going to go to seek help, where are you going to go to seek treatment, where are you going to go to feel comfortable seeking help and seeking treatment. And so patients are on Facebook, patients are on Instagram, patients are on Berry Nation. Where can I find this provider that has good reviews and that patients enjoy and respect and can really help me, fight this battle?
Yep. And that is exactly what this conversation is about today. And why I'm so thankful for this is I know there are a lot of people out there who would like to start treatment, but they're scared or they're embarrassed for whatever reason. They don't want to talk about it with somebody else. And that's okay. Today's conversation is about how you, the individual, can find an obesity medicine specialist that is going to help you fight this disease, right? For the immediate and for the long term. So today we're hoping that you leave with four things. You're going to know what to look for when it comes to an obesity medicine specialist. You're going to know where to look, right? Where can I go and find these people on my own? And then of course, right, if you would like to reach out, where and how you can reach out. We want you to know what to ask in your very first appointment and know that it is okay to leave that appointment or not go back to that specialist if it isn't working, right? And that doing that is not a failure on your part. It is you really stepping into your personhood and your patienthood and understanding I need care to happen in a different way. And this person just wasn't the right fit. You're not going to
Right.
buy a pair of Levi's if it doesn't fit right and look good. So we're going to do the same thing with how to find an obesity medicine specialist today.
That's right. That's right.
Yep. So that's what's on the conversation docket today, friends. So before we dive in, Dr. Thompson, will you introduce yourself to our friends that maybe don't know you yet?
Of course, of course. Thank you, April. So my name is Charles Elisha Thompson III. I'm born and raised in Washington, D.C., moved to Carolina for a few years, and found my way back. Found my way to New York. I've been here for about 13, 14 years now, so I feel like a little bit like a New Yorker. My wife is from here, and which is why we came to New York, so they could help out with our kids. We have 3 children, a boy who's 11, and we have twin girls who will be turning 9 tomorrow. April, I told you that. So,
Mhm.
yeah, it's not 9 going on 19, as I'm sure your audience can understand.
Mhm.
So, I've been practicing bariatric surgery for the past 13, 14 years. I did my training, started out at Howard University in Washington, D.C., and did my fellowship training under an amazing, amazing mentor, Dr. Raul Rosenthal out of Cleveland Clinic, Florida. After that time, that's when my family and I relocated to New York, back in her home state. So I've been all over the New York City metro area. Right now, I'm currently practicing in Brooklyn and in Queens, mainly Brooklyn, but Queens as well, serving our communities here. And I'm having an amazing time, as I always have, but having a truly amazing time in the Brooklyn, Queens community, treating patients that certainly in disproportionate levels need our help. So um, that's about it.
And you love Nike Air Maxes 95
And I
specifically.
love Nike
So
Air Maxes. Actually, and April, I listen. My wife is going to be watching this, so actually the one who bought me those pair of shoes. I think it was for my ex birthday. I'm not going to say what year that was, but she bought those several years ago because she knows that my parents they didn't believe in spending a lot of money for shoes, and so now I'm finally able to have those pair of shoes. Almost 30 years later.
hey, it doesn't matter when the shoes arrive in your life. What matters is that they have arrived. That is all that matters.
That's right.
All that matters.
That's right.
What drew you to bariatric surgery and obesity medicine, right? Because I know this is one of the most skilled places that you can reach as a surgeon.
Well, and I appreciate that, April. It does take training. It does take a number of years. And so much of what any of us do in our medical profession or just professions in general is geared and led by your mentors. And I had wonderful mentors in residency, Dr. Terrence Fulham at Howard University in Washington, D.C. He was a great teacher, a great mentor, and he introduced me to bariatric surgery. But on an individual level, what I found out about bariatric surgery was I was able to meld two very important aspects, at least to me, two very important aspects of medicine. And that was number one, getting to know my patients,
Mm,
and number two, performing surgery. If going back to the gallbladder example, if I take out a patient's gallbladder, I meet them once before the operation in the office. I meet them a second time on the day of operation, and I meet them a third time for post-operative checkup, and that's it. Um, and as I was going through medical school, I always enjoyed the family practice rotation
mm,
because I felt that there was a connection that those family medicine doctors had with their patients. They know them, from a medical and physiologic perspective, of course, but also they knew them from a familial and a collegial aspect as well.
mhm,
And bariatric surgery allowed me to marry those two concepts, the idea of getting to know your patients, growing with them, and the opportunity to, of course, work in the operating room as a surgeon and use the technology and be part of that, amazing part of medicine. So melding the familial with the technological and the manual really is what drew me to bariatric surgery, and it's one of the best decisions that I've ever made and had the pleasure to carry out.
My procedure changed my life in every way possible. And to have a true lifelong relationship that really does follow you as the disease progresses, I think is so important for just overall health and wellness of not only you, the patient, but also the care team that you're working with. Because
Right.
the more that you get to know somebody, the more that you really get to see and understand how the disease is impacting that person individually, which we know, right? Obesity is very much an individualized disease.
Yes.
And what I need isn't necessarily what somebody else needs. But if you know that, you are treating me at a level that I've probably never had before. And that's meaningful and important because this disease impacts every facet of our life.
Every single facet, obviously from the physical to the emotional to the
Mhm,
psychological.
mhm,
It part of the issue with obesity and why it affects so many different parts of one's life is because of how obesity is characterized in our society.
mhm,
It wasn't until 2013 that the American Medical Association designated obesity as an actual medical condition.
mhm,
So before 2013, people like myself, healthcare providers in general, though a few of us maybe treated obesity as a disease process, but the vast majority of us didn't even view obesity and still don't to this day as a disease process, as a medical condition. And on top of that, there is a lot of, I use this S word again, stigma associated with obesity from non medical people in our communities and medical people in our communities.
mhm,
And so not only are our patients fighting a disease process, but they're fighting the emotional and psychological components that are associated with the disease because of the society that we live in, which makes it completely unlike any other disease process. It makes it a much more difficult process to treat.
mhm. And if we're following along with notes, friends watching and listening, I hope you've already written two things down. You want to find a provider that truly treats the disease as it is, right? This lifelong chronic and progressive disease. but you also want to find a provider that is telling you, I'm going to walk alongside you as this disease progresses. Two
Right.
extremely important things, right? Because Dr. Thompson, what you're acknowledging is that people are showing up in your office carrying a lot of extra things, carrying extra shame, extra blame,
Yeah.
feeling right horrible about their inability. And I'm saying this in air quotes for you guys listening, their inability to lose weight on their own, right? So they are coming to you with all of this extra emotional weight. And for you to be able to help them or teach them how to kind of put it down or put it to the side is really important, because it's difficult to break that care wall or care barrier if they're not willing to let that go.
Yeah. One thing that I learned very early as a bariatric surgeon was that patients coming into the room to see you for that initial visit have already broken down so many walls that in the past may have prevented them from coming to see you.
Hmm.
And so, on that first initial visit, I congratulate patients all the time because, and for various reasons, but many patients have very difficult time just even admitting to themselves that they have a
Hmm.
problem that they need help with.
Hmm.
They also have problems with overcoming others that may be in their, close environments that say, "Oh, you don't need to do anything about that. Look at me. I'm the same way." And they sort of they sometimes shame patients for seeking help.
Yeah.
And so when they come to the office, they're already, you know, going against the odds, right? They're
Yes.
already going against the odds because, as we know, if you have 100 people who have this medical condition, only 25 of them will have any kind of treatment. And by any kind of treatment, I mean, you know, maybe you should diet and exercise a little bit at the bare
Oh,
minimum. Yeah. Only 10 to 15% of patients get any kind of medical treatment, and only 1 to 2% of patients receive bariatric surgery. So, there's a long way to go that we have as providers in educating our patients, but more importantly, educating society
yeah.
about, what needs to happen in the treatment of this medical condition.
You're echoing things that one of your colleagues, Heidi Bernardchuk, and one of our experts in Berry Nation, Monique Coleman, have recently said. Heidi came across some research that said that that people will be struggling with the disease of obesity for 10 to 13 years before they bring it up with like a primary care physician, which is something that you kind of touched on earlier, right? Like many of these medical professionals, they know that their patient is struggling, but they don't know how to talk to them about it, or they don't understand that it's a disease. And so you just kind of get trapped in this same cycle of eat less, move more, which we know
Right.
is not the case at all.
Yeah.
And in our conversation with Monique, a lot of the pushback she got was from her family members, right? Because the reason was, but you're beautiful, or you have such a pretty face.
Right. Right.
Great, but it's impacting my health in negative ways. So, right, when people are sitting in front of you, for you to say, "Hey, I'm proud of you," is acknowledging all of the emotional work that they've done just to get there in the first place.
Right. And I do want to make a comment about, friends and family saying, "No, I love you the way you are. You're beautiful." They're 100% right. They're 100% right. You are beautiful. They do love you no matter what. And they're not trying to prevent you from getting healthy. What they're doing is they're trying to reinforce their love of you. And unfortunately, they're indirectly making it a little more difficult for you to make that decision to go see a professional um, because they're so concerned about you not feeling. They don't want you to feel bad
Wow. Yeah.
for having this medical condition, right? And that's what they're trying to do. They're not saying you don't need help, you don't need treatment, but they find it more important to make you feel better. And I think that that's not, they don't really understand how to communicate that in a way that both makes you feel better and makes you understand that, okay, yes, maybe you do need to get some help. They rather choose making you feel better than seeking help. And I don't blame anybody, any family member or friend for doing that. And that's why I say when patients come to the office the first time, I congratulate them because Despite the unintended consequences of those friends and family members saying what they're saying, they're still fighting through that and still coming to see us for treatment and for help.
In the 300 plus conversations we've had, no one has ever said that before. And that is powerful because in so many of the conversations that we have with patients, right? In the Berry Nation community, we talk about this each and every day. But to have that word, right? Your friends and family, they do want you to be well. They just don't know how, but they don't want you to feel
That's
bad.
right. That's right. That's
So,
right.
and I think we all know that, but that is really what is at the crux of this. And as you, a person who is struggling with a disease that you probably don't even know you have, right? You know that you're struggling with your weight, but you don't know that it's a disease of obesity.
Right.
If you don't have the words or the education or the courage or bravery to go, thank you, and my health is suffering because of this, so I have to do something about it. It's no wonder that so many people don't continue on with care because they
Right.
don't have that word and I need help. And this
Right.
is a disease.
Right. Right. There's
Ooh,
many different facets to this condition that we've only barely touched the surface of in
yeah.
our communities, in our societies. But that emotional piece is it's very powerful, very powerful. I mean, you know, there are things going on in our society today that make you realize emotional truth is much more powerful than factual truth. And if you feel
Uh,
something, it doesn't matter what kind of evidence, what kind of data, it doesn't matter. What you feel is usually going to win out. And so again, it falls on us as providers to not only continue showing the data because that's what science is based off of, but on the other hand, we also have to continue to understand and to um, empathize, sympathize, and truly connect with our patients. Listen, when patients come to see me, I can tell you a million things about what happens in the office, April. So I apologize, but when patients come to see me in the office, I know why they're there, right? We all know why. They
yeah.
look us up. They say, oh, okay, weight loss surgeon. Let me come see this person, etc. But one of the first things that I ask them is, how can I help you? Why are you here? How can I help you? Because this disease process affects so many different people in so many different ways.
Mm,
And um, in order to acknowledge what that patient that's sitting in front of me for the first time has gone through, I need to be able to hear from their mouths the words that they use to describe what it is that they've gone through. And it makes it
hmm
a much easier, in my opinion, a much easier process for them to be more open and to share. And when that happens, there's more buy-in,
hmm
which is, as you know, April, so important, specifically
Yep.
after surgery. Uh,
hmm
c- Committing to coming to the office, committing to staying as healthy as possible with your nutrition and physical activity. So setting the stage for communication and I'm losing my words here. Communication and sharing is very important in helping patients treat this disease process.
Yeah, the two words that instantly came to my mind were partnership and agency,
Yeah,
right? Like by
partnership
you
agent.
asking those two powerful questions, what you're doing is you're telling the patient you're in the driver's seat and I'm going to listen to you and I'm going to understand you. But I also see the power in that because you're also hearing the words that they're using to describe their life and how they're moving through it. And if you can pick up on that and you are mirroring back the words that they're using, they really know that you understand it and you get them.
Right,
Because what I also know you would not do just based on the conversations that we've had over the time that we've known each other, surgery might not be the thing that that person is ready for, or they don't understand it. And you as a provider, your role is not to say, well, this is the only option or this is the way that you need to go. Your role as a provider is to, again, walk alongside them and say, hey, yeah, you are absolutely presenting all of the symptoms of the disease of obesity. Let me help you understand what this is. And then let's talk about the treatment options that are out there and available for you. And
Right.
then let's have a discussion about which one you feel most comfortable with starting with. That's
That's
a
right.
way different conversation than what most people are thinking they're walking into.
Right. That's right. And, there are patients that come in already know, they already have on their mind what they would like. We definitely have those patients. But, the more you talk, excuse me, the more I talk with patients, and I start to get a feeling that they're just not sure about what it is they want to do. They're not
Yeah.
sure if they want to do anything.
Mm-hmm.
One of the things I like to say is no decision has to be made right now. You're coming
Mm-hmm.
today just to get information. Go back home, speak with your speak with their family about it. You could pray about it. Some patients are very religious. And I'm always here to answer any questions. And that's what you're here for today. But no decision has to be made. And, I really want to make sure that patients understand that this is not something that is being forced upon them,
Yeah.
right? They've already
Yeah.
been felt that they need to do something for decades because of the way that society has treated them while walking down the street, while walking to the airport, while, on a bus. Um, I'm not forcing anything on you. We as providers are not forcing anything on you. Our job is to give you the information and
Mm-hmm.
and for you to make a decision that you think is best for you.
Yeah. And that is a very different approach. Uh, that most people have not encountered before, right? And there's a lot of things that go into that, right? You are the doctor, you're the surgeon, you have dedicated your life to this. So I think sometimes when I go into my own medical appointments, I know why I'm going there, but I'm just going to listen to them because they're the ones that have the knowledge. But in the interactions that I've had with doctors that I value the most, it is when I have that space to go, here's what's going on. I don't understand this. I'm so frustrated. Here's what I've tried. Like what's up? And to have that space for dialogue and conversation and to really understand what is going on in the background, that's when I feel like I've made the biggest gains in my personal health, not necessarily when I've just showed up and somebody says, do this, this, and this.
Right. Right. Yeah. No, it's all about the buy-in, and
Yeah.
putting the ball in the patient's court allows
Yeah.
them to play, okay, and
Yes.
allows them to really feel involved, feel in control. You
Yeah.
used that word earlier, agency, gives them
Mm-hmm.
agency. And
Mm-hmm.
that's very important because they're gonna need that after surgery, or they're gonna need that once they start their medications. They're gonna need that just with diet and exercise if that's what they try. They need to have the agency and the confidence to know that they can make the change. So that's what we
Yes.
try to instill.
Okay. So let's step back a little bit because I feel like we've done a really excellent job of talking about what we need to look for, right? When we're trying to find this person. But where do we even start, right? So if somebody's watching or listening to this podcast, they've been struggling with their weight forever and they think they're ready to do something, right? What would you tell them today that you think will help them go online and kind of start this process to find somebody?
To be very honest, I would start with asking or recommending that they talk to someone they know that has had, significant weight loss and what it is that they did. If
Mm-hmm.
they had surgery and the patient is interested in surgery, were you comfortable with your surgeon? If the patient had medications and was comfortable talking to the provider that gave the medications, you know, do you feel that I should go to your provider? Again, word of mouth is the best.
Mm-hmm.
Word of mouth is there's no question about that. Now, if you don't have any friends or family that you know that have gone through this process, Google. You can go to Google sites. You can certainly go to the asmbs.org site, the Obesity Action Coalition website.
Mm-hmm.
And without question, the Berry Nation website and groups. And to be honest, I think Berry Nation and organizations like yours, April, are the best because it almost is a word of mouth because you have
Yeah.
actual patient experiences and you're
Mm-hmm.
not going to, patient's not going to a website that's just made to give information. Berry Nation and organizations like yours is patient based.
Yeah.
And the one thing that I would caution patients with is our forums that are on Instagram
Mm-hmm.
and Meta or Facebook,
Mm-hmm.
because oftentimes those kinds of forums are patients are receiving a lot of information that's
Yep.
not good information.
Mm-hmm.
And organizations like yours, though they are patient based, all information is vetted.
Yeah.
Things are appropriate and proper and peer
Mm-hmm.
reviewed that are presented on Berry Nation in organizations like yours. So be careful of where you get your medical and surgical information, but by all means, speak to people who have undergone the same process that you have to see if the provider is someone that they would recommend.
Yeah. The forums on those social media sites were one of the reasons that I was so passionate about creating Berry Nation. The word that I like to use is dumpster fire, and that's that is the best way that I can describe it.
Yeah,
Because right, sometimes I think people just love talking about the bad. It's dramatic and it's horrible. But so many people are living with the disease of obesity, but even more people have chose to treat it. And the life after treatment that awaits you really can be and is fantastic. But if you're only getting information from a place that kind of feeds the bad instead of
right,
highlighting the good,
right.
you're not going to find a lot of good things.
Yeah.
And right, kind of like what we talked about earlier, like friends, if you're watching and listening to this and you don't know anybody in your life who has publicly said, "Hey, I treat my disease of obesity," you now know me and now you know Berry Nation. And if you trust me, I'm willing to say it was the best decision I ever made. I used word of mouth and I went and had a conversation with somebody, with a professional who could help me treat this disease. So if you're watching and listening to this and your weight has been a struggle for a very long time and you have tried diets and you've tried exercise and you've done all these things and your weight has gone up and down, up and down, up and down, yet your health continues to decline, you more than likely have the disease of obesity and it needs to be treated. And please use this as permission to do the next thing, which is what we're going to talk about. How do we find a provider like you, Dr. Thompson? What would you say is like the first 2 or 3 things that you hope people are doing to start?
Well, April, I going back to something I said a little earlier, if you don't know someone who can refer you, go to those websites. But the thing that, you and I have talked about this, don't feel that the first provider you go to has
Mhm.
to be the provider that treats you.
Mhm.
This is very much, or it can be very much a trial and error sort of, hopefully it's not too long, but a trial and error process. It's very important. Listen, we all have we all have fingers and can prescribe medications. There's no
Mm.
differences in doctors prescribing medications. For the most part, surgeons are surgeons. We can all operate, we can all do the procedures and perform them perfectly. But there are docs who are a little bit more able to communicate with patients um, more efficiently or better than
Mhm.
others.
Mhm.
And, I hope I'm not, offending any providers that are out there, but, there is a bedside manner that is on a scale. And some docs are, on one part of that scale and other docs are on another part of that scale. And treating obesity mandates that you have somebody that's able to listen to you and someone that makes you feel that they are concerned.
Mhm.
Because the better you feel, the better your outcomes will be,
Yes.
and the more that they will be maintained.
Yeah, I love that word. I love that mandate. I would agree with you. I mean, I've had wonderful doctors really my entire life, but not a single one of them ever gave me a referral to an obesity medicine specialist ever. And I've gone through a lot, I feel, as a patient, and I wish that one of them would have done that because it would have changed the trajectory of my life. But we're here, and that's what it is. But what we have the ability to do today is help others move through this process a little bit more efficiently and find that provider that does see this as a mandate, right? To treat it as a disease to walk alongside you.
That's
And
right.
friends, in the show notes of this episode, there is a printable document that we have made for you, right? Dr. Thompson and I and the Berry Nation crew, we've gone through this, and it is a step-by-step process that you can follow, and it's totally free to help you find the person and the team that is going to work best for you. So, right, this first kind of stage is talk with people in your life, right? Or head to the Berry Nation website, head to the Berry Nation YouTube channel, see the people who we have interviewed, start to get to know the people like Dr. Thompson who are out there. Your second step is, if you have insurance, call the number on the back of your card and see who is in network for you for an obesity medicine specialist, provider, or surgeon. Get that list. Then head to Berry Nation or head out and see if one of those people is also on the places that you are at. And once you have found a few that you'd like to reach out to, go to their websites and book an appointment. Get a consultation, because just like what Dr. Thompson said, that first interaction, hopefully no decision is made. It is your opportunity to literally try that person on and see if they're a good fit, if you vibe with them, if they are asking you, why are you here? How has this impacted your life? What have you tried in the past? What areas of your life do you really feel like are being impacted by the disease of obesity? And while you're making those appointments and you're getting ready for them, you can also start learning about why obesity is a disease, right? Why everything that you have tried has not worked before. This is your opportunity to take in that learning. And if you don't know where to go for that, we've built the Berry Nation community for that exact same reason. It is where you can
Right.
go to understand why what you're fighting is a disease and be surrounded by people who are actively fighting it. And Dr. Thompson, I know you and I've talked about this before. Berry Nation is not the place for sunshines and roses, right?
Yeah.
Treating the disease of obesity is work. It is
Yes.
exhausting. It can be
Yes.
grueling. It's lifelong, it's chronic and progressive. So even
Yes.
though you onboard treatment, the disease isn't going anywhere. The disease has been treated, but ongoing management and ongoing education and awareness of how the disease is progressing in your life is how you continue to treat this, because there's no cure for obesity. None.
Yeah. Yeah. And, what I often tell patients and other providers, friends, family, you know, technology is just far outpacing our biology.
Mm-hmm.
And what do I mean by that? I mean, today, you don't have to do anything. You don't have to leave the home to do anything. You stay at home to work. You stay at home. You can grocery shop at home. Amazon can deliver 50 million boxes to your home in 1 hour.
Mm-hmm.
Okay. You know, so the technology that has allowed us to do these things, which literally 50 years ago, you were out of the house doing all of these things. Um, the technology has allowed us to not be as active. Um, Also, as we all know, and I'm not going to get too scientific here, but evolution takes centuries, millennia,
Yeah.
and in the past 200 years, even the past 100 years, we've moved from a much more active community to not as active community,
Mm-hmm.
putting it lightly.
Mm-hmm.
And that's not to say that treating the illness, treating obesity is simply about being more active. What I'm trying to say is that the biology has not had a chance to catch up
Yeah.
to the little activity that we need today as compared to 100 years ago. There's many, many, many different causes of obesity, and where those who may not understand the disease process may think that it's simply about putting the fork down, as some people like to say.
Mm-hmm.
We know, providers know, specialists know that only represents about 5 to 10% of the patients who are dealing with obesity.
Wow.
There are environmental factors, there are societal factors, there are socioeconomic factors, there are genetic factors. There are a lot of factors involved with our current inability or current difficulty in losing weight. And I can go on that topic for a very long time. But one of the things that I, again, like to tell our patients is it's not your fault.
Yeah.
Usually, it's not your
Yes.
fault. And because I think, April, a lot of times our patients, patient comes to me, they're 50 years old, they've been dealing with obesity for 35 years since high school. The message has been it's their fault. It's because they're not active enough. They're lazy or, this and that. And it takes a lot of work to break down that misinformation and to have patients understand that it's not their fault. It's again, that's why I say, unlike any other disease process, bariatrics is and weight loss, difficulty in losing weight has a lot of emotional and psychological components that is not seen in the vast majority of other medical illnesses.
Yeah, no, not at all. And what I feel like is our modern world is really built to feed into the disease at capabilities that we've never seen before, right? I absolutely understand that. And I appreciate you saying there are percentages of people who have the disease of obesity where it can be managed by diet, by movement, right? By making tweaks to certain medications. It doesn't mean that they don't have the disease of obesity. What it means is that their type of obesity is treated in this way.
That's
But
right.
obesity is a spectrum. And unless you are seeking out individualized care, you're not going to know where you fall in that spectrum. And I very much appreciate you saying what you did earlier, Dr. Thompson. We're just at the forefront of starting to understand what this is. And it feels like, right, the medications that are out there that we see advertised, everywhere. Sometimes in our perception, we can think, well, that's the magic thing. That's the thing that's going to work. And medication is an amazing treatment for the disease of obesity. It's probably not going to be the only one that you need. In my lived personal experience, right? Diet, exercise, all of the things that I was being told to do, I was doing with fidelity. And yet my disease was not responding. What I've noticed now is after I onboarded surgery, my diet, movement, focusing on my mindset, attending support groups, right? Doing all of these things work at a higher efficacy. Right. So it's like surgery helped all of these other things that I was doing work even better than they ever had before. But if I didn't have that education, if I wasn't able to have these kinds of conversations, I would just think that everything that I was doing was a failure and I wouldn't seek out treatment because nothing that I would do, in air quotes, would ever matter. But that's simply not true. The disease mandates individualized care and attention. And you as the individual are going to need an individualized plan to continue to treat this disease.
That's right. That's right. And that's why it's so important. Certainly with the vast majority of surgical weight loss programs, going through an education process is mandatory. And not only before surgery, but most importantly, after surgery. And what we're starting to see is that, unfortunately, patients are getting access to medications without getting the education that's needed, as you just said, April. That very important adjunct of having someone, on a consistent basis, monthly or every other month, teaching and guiding and just checking to make sure that you're following the healthy habits and proper nutrition. Now, listen, the other piece is nobody's perfect, and I don't think there is a healthcare provider that expects you to always eat the right things, always do what's best. I mean, we were at dinner a few months ago together, April, and listen, things happen, but.
Pasta, drinks,
pasta,
things happen. Bread,
But nobody expects you to do perfect all the time.
Yeah.
But what's much more important is the majority of the time, having those healthy habits, participating in healthy lifestyle activities. So surgery or medicine is just a part of the entire process of getting healthy. It's not a quick fix at all. And that's
Hmm.
something that is, to be honest, I'm not hearing it as much as I used to be honest. But that's something that I used to hear a lot of people say, oh, I want to just do this. It'll help me, lose weight
Yeah.
quickly. And it's not a quick fix. It's the beginning to a lifelong process of feeling better and getting healthier.
Yes. Oh, yeah. No, I can testify to that. I definitely went into surgery thinking, oh, I'm just going to eat less and I'm going to lose weight and everything's great. Now, almost 7 years post-op, I understand I had metabolic and bariatric surgery. I have metabolic disorder. The disease is very much ever present in my life, even though I've onboarded, right, that initial treatment of surgery. And if I didn't continue to treat it, I would be right back where I was before, not because I'm doing anything wrong, because that's what the disease is designed to do. It doesn't want to leave your system. It's a part of my DNA. It's not going anywhere. So I have to learn how to be roommates with it and I have to learn how to treat it. And I also have to get to a place where I need to respect it because it is a part of me, but I am not a disease, right? So you're learning to walk this line between who you are and the thing that is never going to leave you. And that takes time, effort, dedication, focus, energy, all the things.
That's right.
But I can't imagine living this life today had I not made the decision to treat it. Today's life was not accessible to me before initial treatment. It just
Yeah,
wasn't.
yeah, yeah. And you're an amazing, representative, April, of patients for patients who are having difficulty losing weight, and you
Yeah.
being open and transparent about your journey and what you've gone through, and this is why the Berry Nation is so powerful and so important.
Well, I'm one of many, but I apparently have a great voice for podcasting. So here we are. it's, it's how it works.
Very clear.
Dr. Thompson, when people, let's say, are looking at a website, so let's say they log into their insurance provider, they see a bunch of names listed. There's a lot of letters that go after people's names, right? PC, primary care provider, right? Nurse practitioner, obesity medicine specialist, bariatric surgeon. What titles should people be looking for to find somebody like you?
Yeah, it's a very good question, April.
I know. But it's confusing, right?
Yeah,
Because as a
yeah,
patient, you see all of them and you're like, how do I know that this person can
right,
actually treat me?
right. So to be very honest, I wouldn't look at any of the letters after anyone's names. I wouldn't be looking at any titles after anyone's names. What I would be looking at is um, the the words that are describing how they deliver their care.
Ah, okay.
One may say, yes, you should look for FASMBS, meaning a fellow in the American Society of Metabolic and Bariatric Surgery. That might denote more professionalism, more knowledge, more experience. However, that doesn't speak at all to the provider's ability to connect, communicate, and empathize with their patients. But looking at maybe the paragraph right under their name
Hmm.
describing how they deliver their care, um, that does a much better job of letting a patient know who they are as a
Yeah.
person, as
Hmm.
someone that is concerned about their patient's condition. So yes, you want to see the MD or the DO or the NP or the RN or the RD for dietitians. You perhaps want to see a fellow in the American College of Surgeons or a fellow in obesity medicine or fellow of the ASMBS. But much more important is that paragraph beneath or around the name that describes how they deliver their care.
That's a really great point, right? I mean, I've got degrees hanging on my wall. They say that I'm a master educator, but it certainly doesn't say my philosophy when it comes to how I work with kids. So it is important to see, right? Like a fellow with the ASMBS means they've gone through training, right? They are active and involved in this society. They are wanting to be on the cutting edge of things, which is wonderful.
Right.
But if you also don't know kind of what their individual philosophy is, that's you could be missing a big part of it.
That's correct. That's
Okay.
correct.
Okay. So, right, doing your due diligence, doing the research is extremely important. And I think this conversation has absolutely highlighted that. If you do have insurance and you, right, have gone through an initial appointment and you make a decision that you want to continue with some type of treatment, a specific treatment, maybe it's medication, maybe it's surgery, maybe it's a combination of all of those things. We know that having insurance, right, having access to it doesn't mean you can utilize it. So, will you help us understand what that difference is between access and utilization?
Yes. So, let me start on the easier side first. Medicare and most forms of other government sponsored health plans, Medicaid plans, offer weight loss surgery
Uh-huh.
um, without question. Unfortunately, on the other hand, there are not a lot of Medicare and Medicaid plans that are able to offer weight loss medication.
Uh-huh.
Some of that is starting to change, specifically if
Uh-huh.
patients are diabetic, or even I think if they have obstructive sleep apnea
Uh-huh.
on the Medicaid side.
Yeah.
You're starting to get a little bit more access to these medications. But ironically, weight loss surgery is without question available if you have Medicare or Medicaid. Now, going to private practice, or I'm sorry, going to private insurances, there are many plans that offer bariatric surgery. Sometimes and offer the ability to get weight loss medications. But often the confusing part lies in there are sub plans that you may belong to that will exclude you from surgery or
Uh-huh.
medication. And usually, this is if you're employed, that's because your employer has opted not to have that part of the plan, has opted not to have that coverage as a
Uh-huh.
part of your plan.
Uh-huh.
And I listen. This is America. We live, in capitalism. So I can't blame an employer for doing that because it may cost too much for them. On the business side. Again, another topic that we can talk for hours about. But I think that in the future, what's going to really need to happen is a federal mandate
Uh-huh.
that requires treatment of obesity.
Yeah.
You don't have to worry. And April, you were there with us a few months ago when this was brought up. But if you have heart disease, if you have coronary artery disease, you don't have to worry about your plan covering coronary artery disease.
Uh-uh.
You don't have to worry about that. It is covered, whether it's government issued insurance, whether it's private insurance. You don't have to worry. Your heart disease is going to get covered. Now, I think the most recent numbers is that coronary artery disease affects about 5% of adults in this country.
Way less than obesity. Way less.
Absolutely. Obesity affects somewhere between 40 to 45% of adults in this country. And we
Mm.
have to worry about whether insurance plans are going to cover this. So
Okay.
you have a disease process that represents 5% of adults where it's covered hands down no matter what. And you have a disease entity that covers that is where 40 to 45% of the population is affected. And we have to worry about if your private insurance is going to cover treatment for this process. It
Yeah.
doesn't make sense. It does not
No.
make sense. So that's why I'm saying it's going to probably take some sort of federal mandate that is requiring coverage in private insurances. It's going to mandate coverage for weight loss services across the board.
Yeah. And I have a perfect example of this, and I share this with full permission. My husband has the disease of obesity, and we have bariatric surgery coverage, right? So we have access to bariatric surgery. He's been denied now 2 times for a surgery that he has access to. So we can access it, but we cannot utilize it. And the back and forth ridiculousness that we have had to go through is heartbreaking. It's soul crushing. And for my very strong and powerful husband to be told no when it comes to being able to utilize the care that he has been devastating. Like his
Yeah.
disease is to the point where it's impacting his ability to work. And the frustration and the disappointment, it is soul crushing. I mean, it took him 10 years to get to the point to make the decision to have surgery. And he has a wife who's active in the obesity medicine care space.
Right.
So for him to finally get there to be like, yes, I'm ready to do this is, as we've already talked about, monumental. He's done all the hoops, all the gymnastics to get there. And then to get 2 denials in a row to say it's not medically necessary for for something that he has covered. I mean, it's like, oh my God.
If
And I think
you
this,
yeah, if you don't mind, April, would you be able to share why he's being denied?
the denial is it's not medically necessary, even though he's class 3 obesity with comorbidities and a direct impact on life.
Hmm.
Yeah, it
Hmm.
is devastating. Now, we have a care team that is absolutely phenomenal, and I have permission to share this as well. But Dr. Joe Cribbins in Texas is going to be his obesity provider.
Okay.
They are bulldogs when it comes to helping people utilize the care that they have access to. But I know not everybody has the capacity to do that,
Right.
right? So
Right.
how do you work with your patients, Dr. Thompson, if they have access but are not able to utilize it? Like what is your process?
So it's a very difficult situation because unfortunately, the people who are reviewing these authorizations, they have, I don't know, tens, hundreds maybe of
Mhm.
authorizations to look at, on a daily basis.
Yeah.
And then they're not putting thought and emotion into it. They're simply going by what their employer, the insurance company, is saying is
Mhm.
a qualifying issue or not. The only thing that we can do as providers is just continue to fight, continue to
Yeah.
send letters, continue to send evidence, continue to, also, having the patient involved as well, having the
Mhm.
patient send letters, having the patient be an advocate for themselves.
Yeah.
And, you just gave me an idea. Maybe we need to have some sort of, organization specifically aimed at helping patients fight through denials for bariatric coverage, um, putting a little
Hmm.
bit of my information out there. We identified um, some difficulties that one of my children was having in school, and we had to fight for services that are available to our child, but we don't know that they're available, and
Yep.
even if we know that they're available, we have to jump through hoops to get them. And so there are organizations that help us fight through that red tape and get those services for our child. And perhaps it should be something like this for the bariatric community, for the patients who are suffering from this condition. So that's something we can talk about offline.
Oh, I cannot tell you. We have coached, supported, drafted, walked alongside so many people in the Berry Nation membership community who have
Mhm.
gone through exactly this
Mhm.
denials, and we have talked about here's how you fight back while also acknowledging, and this is kind of the fine line that we have to walk. Those denials are brutal, right? They are soul crushing. And after you have worked so hard to get to this point, right, with treatment, we understand that you just could be out of gas, right? There is no fuel in that tank. And we are not here to push you beyond what you are emotionally and physically capable to do. Because at the end of the day, you as the patient, the work falls on you. But
Right.
what we've seen in Berry Nation though is that it's a safe place for people to go and just share this frustration, right? To let out the pain and the anger and the guilt and the shame and to refuel, right? It's your safe place to just go, this sucks. and I am out of energy to do it. And we can hold space for you to just exist and be. And when you are ready to pick up again, right, to fill the tank and to kind of carry on down your journey, we've been able to walk alongside people. I mean, we've had people that have posted like, hey, here's my draft letter that I want to write to my insurance company. Is it strong enough? Do I include enough information? Like, what do you think I should add? And to
Right.
have a collective community who knows what it feels like to fight this disease, add kind and compassionate input, we have seen people, right, change the direction and care that they're receiving. Because not only, right, do you have the energy to fight, you have a nation of people behind you, and you have a few eyes on this.
That's
So
right.
when
That's
patients
right.
and providers like you are able to go, no, 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 we're fighting this. And we're on the provider end, like I've seen Dr. Joe and his team say, no, we're doing this. We're asking for a peer review. We're gonna ask that you do this and get this information in. And Grady, we need you to do this. We need you to write this letter. We need you to advocate for that. So when you've got two parallel tracks of advocacy pointing at the same end goal, which is this person will utilize the care that they have access to, more than likely we've been able to see a change. And thank gosh, Dr. Joe and his team are like, nope, we're 99% sure that this is going to work. We're going to continue to fight, fight,
That's
fight.
great. That's
And I
great.
see
Yeah.
you and your team doing the same thing too. It's like, yeah, this
That's right.
sucks, but here's what we're going to do. Can we ask you to do this alongside you? And the point that I think we've made here is, even though as a patient and a person, you're tired, you're exhausted, shame and blame, you're going to have to keep fighting. You just do, because
Right.
that's what is required of you as a person living with obesity today. And
That's right.
hopefully through advocacy and change, it will be more like other diseases are treated here in the United States, but we're not there yet. And that means
Yeah.
that we have to team up to continue to fight to make
Yeah.
this accessible.
Yeah. A lot of work to be done. That's for sure.
Lot of work to be
Yeah.
done. So, Dr. Thompson, if a provider is watching this conversation, right, no matter what type of medicine they practice, what's one thing that you would like them to know about how you hope people change the treatment of the disease of obesity?
I think that in this day and age, physicians are still one of the most listened to professions.
Mm,
It's still one of the professions that people listen to the most.
yep.
And I think that we need to learn how to continue taking advantage of that by understanding. Really, it all begins with understanding that obesity is a medical condition,
Hmm.
and that usually patients who are having difficulty with this condition, all they're doing is waiting for the right person to bring it up, to
Hmm.
acknowledge that, yes, you are having difficulty with this. Here is how I can help you. And as healthcare providers, people still listen to us, and we need to use that leverage and trying to treat this condition that affects almost half our population. So I would like providers to understand. Number one, of course, that obesity is a medical condition. It's not just a social phenomenon,
Hmm.
and that they can use their leverage as someone that's universally listened um, to help our patients, get healthier, help our society and our communities get healthier.
Yep. And I'm going to share a script that I wish one of my providers had used on me when I was struggling. If any one of my providers would have said, "Hey, April, I know, look, we've tried diet, we've tried exercise, we've tried, these different medications, nothing seems to be working. I know you're frustrated and I'm frustrated with this too. I think you have a disease and it's called obesity. And I'm not an expert in this, but I think you are presenting, right, the symptoms of this. And I want to refer you to an obesity medicine specialist so that they can help you." If any
Yeah.
one of my primary care providers would have done that, I would have called that referral in the car. I probably would have been
Wow.
dialing in the elevator going downstairs.
Yeah.
So it's
Yeah.
okay to say, I'm not an expert in this, but I see your frustration and I'm frustrated. And I want to refer you to an obesity medicine expert.
Yeah. April, that's excellent. What you just did was you very much humanized that interaction as opposed to, other medical conditions. All right, you have diabetes, you're going to take X, Y, and Z,
Yeah.
this many units of insulin. Okay, follow up in a month. With obesity, as we've discussed through this whole interview, it requires a humanizing aspect
Yep.
to open up that door, to open up that line of conversation, that line of communication, to empower patients and to give patients that agency.
Yeah. The word that I keep personally coming back to that helps, I guess, describe the frustration that I feel around obesity care is obesity doesn't have the same reverence as cancer or heart issues or right lung disease. And when I think about people who have lung disease, let's say, and they've been a smoker for a very long time, they're not shamed or blamed and denied treatment because they now have lung disease, right? There's this reverence of, oh my God, you have lung disease, or oh, you have cancer. And there's this immediate care and there's this immediate treatment plan. There's this commercial that I love, but I hate. And it has to do with cancer. And it's like, oh my God, you get diagnosed with cancer. And here's the provider having this conversation, but the person is just white noise, right? They're zoned out. The reverence that's given to cancer in that commercial is wonderful, but obesity impacts your life in very similar ways and sometimes for the rest of your life, whereas many cancers can be treated, right? And there's this reverence there. And I don't think any primary care provider is going to have a hard time saying, "Oh my God, you have cancer," instantly referral. Like, this is not my land of expertise, and you get that referral out. And when you and I were talking about this conversation, kind of like in a pre-production conversation, you had mentioned, you're like, "Man, nobody wants to admit that's not that lane, right? Nobody wants to say,
Right.
I don't know how
Right.
to do this."
Right.
But
Yeah.
we're kind of at the point where we need providers to say, "This is not my lane. This is not my area of expertise, but you need help."
Right. And again, why is it not their area of expertise? Is because it just became a medical condition in 2013, which means that most physicians who were in medical school before then, and even medical school now, obesity is not being taught as a standalone disease process in the vast
Yeah.
majority of medical schools. And so you finish medical school, you finish residency, and you practice what you've been taught, and you have not been taught that obesity is a standalone medical condition.
Yep.
And we're doctors, we're supposed to know everything, certainly about medicine. um,
Yep.
and to admit that you don't know how to treat obesity, and maybe even that you don't know that obesity is a disease standalone, it's difficult for some of us to admit that. You brought up that term, cancer. Obesity will be, if not already is, the cancer of the 21st century. Cancer was really, a lot of research and attention to cancer was brought about in the early 20th century. Um, Dana-Farber and that family, well-connected, wealthy family in Boston. And from there, you got the Dana-Farber Institute, Cancer Institute up at Harvard. But that really started and pioneered the millions and billions of dollars throughout the rest of that century that went into cancer research, and why we do so well now with cancer compared to 50, 60, 70 years ago. We're, again, at the very beginning stages of this obesity epidemic, and we are looking for and we are waiting for that one family, that one patient, that one ordeal that happens that sort of kickstarts and really ignites the passion for the treatment of obesity, that kickstarted and ignited the passion for the treatment of cancer in the early part of that 20th century.
Wow.
And if we don't, you know, really, get in line and everyone get on the same page, we're really going to start seeing some very devastating effects, um, that obesity is going to have on this population, on us, in the next, 15 to 20 years.
So really what I hear you saying is that the people who have stepped up and busted through the shame and blame of what they've been feeling and onboarded obesity care are the pioneers. They are at the forefront of changing how this disease is talked about, treated about, and lived with. So we really are in that beginning stages of what could eventually become what cancer has become, right? Is the thing that is solved, the thing that is looked at and researched to the point of absolute understanding.
Cor-
That is now.
Correct. Very correct.
Wow.
And I just, not absolute understanding, not complete knowledge, because we still don't have complete knowledge of cancer,
No.
but we're certainly far, far, far ahead of where we were 100 years ago, even 30, 40 years ago. We're so far
Yeah.
because of the time, the energy, the passion, and the money that went into the research of cancer diagnoses. We need the same for obesity.
Yeah. And I guess what I'm seeing now from my little corner of the world and from the Berry Nation corner is we are getting to a point where so many people are willing to speak out about it and say this is not right. This needs to be done differently, right? The impact of my quality of life needs to be addressed. I do kind of feel like that wave is building a little bit because we are not afraid anymore to talk about the impacts of the disease and how not treating it is preventing us from living our best, fullest life. And as I say everywhere, the world needs the best version of us right now. Right? The world is on fire. And if we are not well, if we're not capable, and if we don't have access to all of who we are, things are not going to go well. And obesity is preventing us from being fully present, from being the best version of ourselves.
Yeah, absolutely, absolutely. And there is a wave. There is the recognition of obesity as a chronic medical condition.
Yeah.
But in my opinion, that wave needs to get faster and larger,
Mm-hmm.
much more quickly.
Mm-hmm. We are with you on that. And that is really the mission of Berry Nation, right? It
Yeah,
is to walk alongside people. It is to empower people to onboard the care and the treatment that they need and then walk alongside them as they continue to treat it. I mean, I would like nothing more in my lifetime than to have a cure for obesity, right? To advance the treatments, to ensure that people are not living with this for a significant amount of time. Uh, but that's how we get to a better world is that we start with the thing that is preventing people from doing that. And it's going to take a lot of me and millions of voices to just say enough is enough. We are not going to
right,
continue to do this, which is why
right,
this conversation is so important because right, while we can ask our primary care physicians, while we can ask anybody in the medical profession to talk differently about obesity, we also have to ask ourselves to talk about it differently, right? So if
right.
you're a patient, if you're a person and you've been struggling with your weight forever and you have a relationship with a current medical provider, the next time that you make an appointment with them, can I ask you to do something? I want you to ask them about the disease of obesity. I want you to say, hey, look, I've been struggling with this forever. I've tried everything. Nothing is working. Can you write me a referral to an obesity medicine specialist or to a bariatric surgeon? I'm ready to go have that conversation. And I want to know if you know somebody who's good at it, right? It's not you calling them out about what they do or don't know. It's not you, blaming them for never talking about it. It's you putting yourself in the driver's seat to just say, look, I need to do something differently. I think you're great, but I need something different, right? We have to be able to do that as patients too.
Right. Absolutely. Empowering and providing agency. Exactly.
Right? Like that is what this conversation is all about. And I really appreciate you, Dr. Thompson, being able to kind of look at this from your professional, view and standpoint and from the patient one. It's hard to hold both of those perspectives at the same time, but both are true, both are valid, and we all need to step up in a little bit of a different way to help people fight this disease.
Yeah, absolutely. Thank you, April. Thank you for inviting me on your platform. And I hope that your watchers, your patients on this platform are able to get something from this conversation that we've had. Thank you so much.
This has been absolutely amazing. I'm going to go through our 4 points just to make sure that we did it. But before we do that, I want to thank you, Dr. Thompson. You have become a monthly supporter of the Berry Nation Foundation.
Mhm. I,
Absolutely amazing. Thank you.
And very welcome. My pleasure, completely. This is my passion, and this is, we have to walk the walk, not just talk the talk.
Well, we could not do it without you and your support, and it means the world to us, so thank you.
Thank you.
All right, let's go over these four questions. So, friends, here's what we're hoping you left with today. Do you know what you're looking for in an obesity provider? And I think we do. We know what some of those letters mean, but we're also reading that paragraph. We're getting to the person, not just the provider. Do we know where to look? And I think we do, right? There are websites out there, ASMBS, OAC, Obesity Medicine Society, great places to start. Berry Nation, contacting people who've gone through the procedure is a wonderful place to start. And just go through the catalog of who we've interviewed. These are people who believe that obesity is a disease and are there to walk alongside you. What to ask at your first appointment? I think we kind of covered that. You said two really awesome things, right? Why are you here and how can I help?
That's right.
Perfect, right? Those are the two questions that your providers should be asking. And for you, we think we've covered that, right? Not being afraid to just say how the disease has been impacting your life. And the last point, know that it's okay to leave if it isn't working, and doing so is not a failure.
That's right.
I think we've absolutely done that. And friends, that worksheet, that printable is available for you in the show notes. Please utilize it, access it. And if you do use it, let us know. And we are here to help guide you every step of the way. The Berry Nation support community is available for you. This podcast, you can go back and rewatch it. You can reach out to Dr. Thompson directly. And how can they do so, Dr. Thompson? What's the best way for them to get in touch with you?
Sure. They can go to my website, my partner and my website, brooklynqueenssurgical.com. You can find all of our contact information there. Is there a way through Berry Nation to? I'll provide all the information through the Berry Nation platform. And you can find me also on asmbs.org.
Mm-hmm.
All right. And also with the triofoundation.org, TREO foundation.org.
Yep. And we'll have all of this linked in the show notes. And we are extremely excited. We are once again the national sponsor for the Trio Foundation's The Walk, the virtual and the in-person one.
Thank you.
Right? We are so excited about this. Movement is one of our movement's one of our pillars, and walking is something that most people have at their disposal. So we are just really excited to be able to amplify that message because, as you said, obesity and the research is absolutely needed to better understand this. And the Trio Foundation with ASMBS is working very hard to provide the funding for that research that will impact us all positively. So we're thrilled to do that. And we'll link all that contact information in our show notes as well. So Dr. Thompson, again, thank you for joining us. This conversation was amazing. And we just really appreciate your willingness to join us and partner with us to ensure that people have what they need to fight this disease.
It was completely my pleasure, April. Thank you so much.
Thank you, friends. If you enjoyed this episode, please share it, and we'll see you soon in the nation. Bye, friends.
Bye-bye.
That wraps up another empowering episode of the Berry Nation podcast. If you enjoyed today's episode, keep the conversation going by joining the Berry Nation membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at berrynation.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at berrynationpodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.